keep looking at it just to calm your fears and to reassure you that this really isn't anything. Another question I've been getting recently is, Doc, what do I do with my mail? That looks a little suspicious. Well, the CDC proposed the following guidelines, and I'm going to run through them. They were recently updated. Handling suspicious packages or envelopes. Do not shake or empty the contents of suspicious packages or envelopes. Do not carry the package or envelope, show it to others, or allow others to examine it. Put the package or envelope on a stable surface. Do not sniff, touch, taste, or look closely at it, any contents that may have spilled. Alert others in the area about the suspicious package or envelope. Leave the area, close any doors, and take any actions to prevent others from entering the area. If possible, shut off the ventilation system. Wash your hands with soap and water to prevent spreading potentially infectious material to face or skin. Seek additional instructions for exposed or potentially exposed persons. If at work, you notify a supervisor, a security officer, or a law enforcement official. If at home, you contact a local law enforcement agency. If possible, create a list of persons who might have been exposed. These are just a few of the questions that I've been getting in my practice on a pretty routine basis, and I figured I'd just put the most common questions asked to me and present them to you. I truly hope that some of these questions might have answered some of the questions that you might have had, and at this point I feel like we should open it up to any discussion you may have on any topics we discussed.
Does penicillin have the same healing effects and power as Cipro? Because I've heard on TV that Cipro can have some ill effects and side effects, and some people have reported that you take penicillin and have the same effect. What is your answer to that?
Well, currently the recommended treatments are three. One is Cipro, the other one is doxycycline, and the other one is amoxicillin. They found that the particular strains that have been out there now are very sensitive to all of these medications. And the recommendations for doxycycline, because the initial thing was Cipro, Cipro, Cipro. Now doxycycline is there, and amoxicillin is actually being used also too, which is penicillin. There are different indications depending on whether a woman is pregnant, depending on whether it's a child. But in all of the different indications for these medicines, it's very important to weigh the risks versus the benefits. I mean, you will want to treat, of course, a pregnant woman despite any potential risk to a fetus. But yes, penicillin in these particular strains does work. Yes, ma'am.
I want to know something. This coping, it's something like what happened down in the Eastern Valley. Does coping depend on how much stress and anxiety you have gone through in your life? Do you cope better because of what has happened
In your past.
Do you learn to, look at it and just walk away?
That's a very interesting question. So you're saying is that if you survived a lot of things